In Unit 14A.II, we will be discussing anxiety disorders. Anxiety disorders are disorders that are characteristic of feelings of impending doom or disaster from an unknown source. It could be a known source as well. But symptoms are typically sweating, muscular tension, and increased heart rate and respiratory rate. All right. The first anxiety disorder that we're going to discuss is panic disorder. This is very acute, meaning it does not last very long. Panic disorders are marked by a minutes-long episode of intense dread in which a person experiences terror and accompanying chest pain, choking, and or frightening sensations. It can last anywhere from a few minutes to a few hours. These attacks have no apparent trigger and can happen at any time. Although, if you're taking a test you're not prepared for, this could trigger a panic attack. Another anxiety disorder is the generalized anxiety disorder, and this disorder is much more chronic than the panic attacks. This is basically an extended version of a panic attack. The person may experience multiple episodes which may occur quite frequently or for a long duration, let's say months or years, and they may have trouble sleeping because of their tense and irritable anxiety. Phobia is another example of anxiety disorders. These are persistent, irrational fears of specific objects or situations. Nearly 5% of the population suffers from some mild form of phobic disorder. A fear turns into a phobia when a person avoids the fear at all costs, which may disrupt their daily life. So some examples of some common phobias. There's agoraphobia, is the fear of being out in public. Acrophobia is fear of heights. Claustrophobia is fear of enclosed spaces. Zoophobia, fear of animals like snakes. It's also important to note that agoraphobia here is also a fear of not being able to escape. So here we see a comparison chart of different things that people feel anxious about or are fearful of. The blue indicates that no one really is afraid of it. Red indicates that there's moderate fear, and then green, there's a lot of fear. So you can see most people are afraid of snakes, whereas very, very few people are afraid of cats and dogs. So how do you cure a person with a phobia? This will be more discussed in treatment, but one of the techniques is called systematic desensitization, also known as exposure therapy. Provided the systematic desensitization provides the person with a very minor version of the phobia and work them up to handling the phobia comfortably. So example, a fear of snakes. If one person has a fear of snakes, you have them watch a short movie about snakes. Then you have them hold a stuffed animal snake. Then you have them hold a plastic snake. Then you have them hold a glass container with a real snake inside. Then you have them touch a small harmless snake and then gradually work up to holding a real live snake. All right. A part of this may be flooding. Flooding is overstimulating the patient with a fearful object. So if a patient is afraid of pickles, then you might want to fill a barrel full of pickles and introduce it to them. This works for some patients, but for others, the systematic desensitization is much better. And then there's obsessive-compulsive disorder. Obsessive-compulsive disorder is unwanted repetitive thoughts, also known as obsessions, that lead to actions, also known as compulsions. So obsessions are the persistent, intrusive, and unwanted thoughts that an individual cannot get out of his or her mind. These differ from worries. They usually involve topics such as dirt or contamination, death, or aggression. So for instance, you might be obsessed with being clean. You might be obsessed with being sanitary. So as a result of this obsession, your behavior will be compulsory, a compulsion to clean. You might excessively wash your hands. You might have to open the door 10 times before you actually enter the room. So obsessions can lead to compulsion. So what is compulsion? It's the ritualistic behaviors performed repeatedly, which the person does to reduce the tension created by the obsession. The obsession leads them to fixate, and in order to alleviate that fixation, it leads to compulsory behavior. Some common compulsions include hand washing, counting, checking, and touching. So some background with OCD. In the United States, 1 in 50 adults have OCD. Most people obsess about something, but it doesn't always lead to compulsory behavior. 1/3 to 1/2 of adults with OCD report that it started during childhood and then built throughout their teenage years. No specific genes for OCD have been identified. When a parent has OCD, there's a slightly increased risk that a child will develop OCD, although the risk is still low. So maybe not genetic causes, maybe environmental causes. Who knows? There is no proven cause of OCD. Another type of anxiety is post-traumatic stress disorder. Post-traumatic stress disorder comes after a trauma or life-threatening event that a person will experience. All right? So soldiers who experience death and atrocities in warfare, rape victims, people who are beaten and mugged might experience PTSD, or people who live through a terrorist attack, or people who live through a natural disaster might experience post-traumatic stress disorder. So some symptoms is they may have upsetting memories or flashbacks of what happened. They may have trouble sleeping because of these flashbacks. They might feel jumpy or hyper alert. They'll lose interest in things they used to really enjoy. And they have feelings of guilt. Note, for some people, these reactions do not go away on their own, or may even get worse over time. You may have heard stories about soldiers coming back from the war, and then when their wife or their child tries to wake them up from their sleep, they'll wake up screaming, or they'll wake up ready to fight because of those flashbacks associated with PTSD. Events that can cause PTSD. Combat or military exposure, child sexual or physical abuse, terrorist attacks, sexual or physical assault, serious accidents such as a car wreck, natural disasters such as a fire, tornado, hurricane, flood, or earthquake. Why does this happen? They're flashbulb memories, guys. Remember flashbulb memories? Only this time, they're not positive memories. They're not emotionally meaningful in a positive way, but they're emotionally meaningful in a very negative way. But still, flashbulb memory. So what are some treatments for PTSD? There are anti-anxiety medications. There's also removal from stressful stimuli, so you would be released from the war if you could not fulfill your duties due to PTSD symptoms. And then there's also systematic desensitization, all right? Exposure therapy, exposing them to the anxiety-inducing stimuli. So what are causes of anxiety disorder? Through the behavioral perspective, they're acquired through classical conditioning and maintained through operant conditioning. What does this mean? Be ready for the test. According to the cognitive perspective, misinterpretation of harmless situations as threatening may selectively recall the bad instead of the good. And in biological perspective, neurotransmitter imbalances can lead to anxiety disorders. There might be too little GABA. OCD is treated with antidepressants like Prozac or other SSRIs. And that concludes our discussion of anxiety.